All right, welcome everyone to today's webinar. We're going to be discussing the specific steps and strategies that Memorial Hermann takes to hire and retain nurses. So the webinar is recorded, and you'll receive it from the Incredible Health team afterwards. This is designed to be interactive, so please do feel free to ask questions in the chat, and we will make time at the end to answer the questions, and maybe we'll even answer some questions throughout as well. Welcome everyone. My name is Iman Abuzaid. I'm an MD by background. I've been in technology for the last 10 years of my career. I'm the CEO and co-founder of Incredible Health, which is the fastest growing career marketplace for healthcare workers. Incredible Health is the only software platform that allows hospitals to hire permanent and experienced nurses in 20 days to hire or less. We flip the script where employers apply to nurses instead of the other way around. Joining us today, we have two fantastic guests. First is Bryan Sisk. He's a Senior Vice President and Chief Nursing Executive at Memorial Hermann. In his role as Chief Nurse Executive, Bryan works collaboratively with nursing leaders, as well as clinical teams and physician partners to improve the nursing experience, while also advancing patient care, clinical practices, and organizational outcomes for the system. He's focused on designing innovative career pathways to help prepare, support, and empower individuals interested in healthcare as a career. We also have with us Matt Kaiser. He's a Director of Talent Acquisition at Memorial Hermann. With the support of a strong team, Matt is working to evolve and optimize the talent acquisition processes, platform, and strategy at Memorial Hermann. Prior to working at Memorial Hermann, Matt was the Director of Talent Acquisition at Children's Healthcare of Atlanta, one of the nation's leading pediatric healthcare systems. And Memorial Hermann is consistently ranked as one of the 100 best companies to work for by Fortune magazine. Memorial Hermann is one of the largest integrated healthcare delivery systems in Southeast Texas. They're based in the Houston area. Memorial Hermann Health System boasts $7 billion in total operating annual revenue. They have 17 hospitals, 265 care delivery sites, and 8 magnet-recognized facilities. These accomplishments, they reflect the organization's commitment to excellence in healthcare and provide a solid foundation for building a thriving nursing workforce. We're thrilled to have you today, Bryan and Matt. Thank you so much for joining.
Oh, thank you. Really happy to be here.
Thanks for having us.
All right. So today we're going to be discussing a few topics. We're going to set the stage, just make sure everybody understands the state of the nurse labor market today in the US and in Texas as well. We're going to be covering how to build a strong nurse workforce. We'll be covering some specific retention strategies, specific hiring strategies, how Incredible Health can help, as well as we'll be sharing some of the data of the Incredible Health and Memorial Hermann partnership too. And there will be time for Q&A. All right, already getting a few questions. The webinar is recorded. You will receive the recording afterwards from the Incredible Health team. All right, let's start with a market overview. Let's set the stage here. We as a country, the demand on our healthcare system continues to increase because our population is aging. But we as a country have not done a great job of increasing the number of healthcare workers to meet that demand. And so there is some pretty severe labor shortages in the healthcare workforce, the US healthcare workforce today, nursing being no exception. Healthcare is the biggest labor sector in the US, and 1 in 8 Americans works in healthcare. And then we are facing some tough challenges as well. So we're on track to be 1.1 million nurses short by the end of the year. The annual acute care nurse turnover nationally is about 19%. The labor costs continue to go up. The labor cost as a percentage of revenue is currently at 48%. And that's not just the temporary labor, but that's also the permanent labor costs are going up as wages increase. And then finally, it's the national average today. It's 89 days to fill a permanent nurse position at a hospital. Matt, I'm guessing you're intimately familiar with some of these numbers. I know your system is doing a lot better than as far as turnover and days to fill goes. Any comments and thoughts just on the metrics?
Yeah, I mean, I think as we look at this, as we know, I mean, it's definitely a challenge out there for sure when it comes to recruiting. I mean, I think overall what we're seeing is, of course, that shortage in nursing. We've got some creative strategies in place, which we can certainly talk about around how you can source talent out there. I think that's primarily, what we're focused on is how do we reach talent out there and be able to find that talent that we're looking for, because they're not always looking for opportunities. They know that they have opportunities out there if they want to pursue those. So for us, it's about outreach. And it's also, and I think Bryan will talk a little bit about this, about pipelines. How do we grow our own? How do we create pipelines into our organization so that we can really create those career opportunities for nurses in our organization?
Oh, absolutely. And the Houston area is no exception, to the rest of the country. It is a very competitive market for talent. Retention is a challenge in the Houston area, just like it is in every urban area in the country. Also just wanted to share some of our recent data. We have 1 in 4 nurses in the US uses the Incredible Health platform to manage their careers. When they are creating their profiles, we're often asking them, hey, why is it that you're considering leaving a job or looking for a new one? By far, the most common reason that they mention is they're looking to advance their careers, looking for career advancement opportunities, and that includes a range of things. It includes cross training, it includes specializing further, expanding their skills, moving into leadership. A new graduate nurse who really wants to specialize faster. It's a range of things, but really looking for more career advancement. The second most common that's selected is they're looking for more flexible schedule. The days of 3 days a week, 12-hour shifts, full-time only are kind of over, and they really are looking for more and more flexibility and to be able to fit work into the rest of their lives. Third is something to do with geography. Either they're trying to relocate or they are trying to reduce their commute time. The data we have from the Incredible Health platform is 1/3 of the hires on our platform are relocating from a different state. So there's quite a lot of movement in the permanent nurse labor market too. And then the fourth is pay related, looking for higher compensation or better benefits and perks. All right. Also, just from a recent study that we did just 6 weeks ago, I just want to highlight sort of the main concerns that nurses have nationally. Certainly a concern around staff shortages, worried about their own burnout, concern around salary and benefits, the work environment, scheduling, and concern around limited career advancement as well. All right, so let me stop sharing. So hopefully that gives everyone a little context on what's happening. So I would love to transition to Bryan and Matt. Bryan, what's your just overall philosophy on how to build a strong nursing workforce?
Well, I think it really comes down to a few key elements that you're not necessarily going to find like in a handbook or a guideline, but it's so simple. I think it's just listening to your workforce, right? And it's like, how do you take and create a culture around making sure that you have those avenues where you can directly connect with your culture and connect that piece then to what the voice of the employee is asking for. And then how does all that tie together? And so we'll talk about a few things in particular when we talk about, when I joined the organization, part of your strategy has to be informed by just being an employee of the organization. What does that mean to me? And so taking a look at our commitment to our EDI, we're very fortunate. We had Toy Harris join us last year, really taking a look at some of the things that in Houston, being in the most diverse city in the country, how do we then make sure that we're taking those principles from our hiring and removing barriers to entry into healthcare as a career and doing those things. We're working with, within an anchor institution relationship where we're dedicated to hiring from the communities our hospitals are in. And how do we do that? And Matt had mentioned earlier about really that grow your own mentality, because recruiting is incredibly important. We'll always, be energetic in that space. Love Matt, need you, Matt, right? But at the same time, if we can really take a look at how do we align differently with our community and our academic partners, take seriously what they're telling us. I think one of the things of COVID, we have to acknowledge COVID is one of those periods where I don't think any of us want to spend too much time reliving that, because it was hard and it was incredibly challenging. But what we should do is learn from it. And what we have learned as an industry is the voice of your employees is incredibly important, because if we're not listening to them, I've been calling it talent wander. It is incredibly easy to move from organization to organization now. A lot of companies have put a lot of energy into some of the things we'll talk about today with like same day hiring and things like that. And so there really has to be a, why do I want to be a part of this team? How does it align with my values? And then how do I then take that forward and apply that to my own career? And so we put a lot of energy into things like, one of the goals I've been talking about here recently is how do we align ourselves to where 80% of all of our new graduate RNs are internal hires? And if you just stop and think about that, some people are like, well, that's a crazy thought. But if we truly align with our academic partners and we have relationships from high school through a community college, through an LVM program, up through an RN pathway, we remove barriers to those opportunities through our EDI strategies and do some of that work. I mean, I think that is a goal that's achievable. We won't achieve that next year, but how cool is it when you can take an individual from the community who doesn't see the opportunity that's in front of them, open those doors, and then they can be whatever they want to be. And so I think that's where we're going to have to go. And we get that from listening directly to our front line. What are those things that you need to make sure that we are supporting your career, your growth, your aspirations? And that only becomes a great thing for our patients, our communities, and the employees too. So it's a lot around culture, and it's a lot around making sure everybody is represented, and it's a whole lot around making sure that we're delivering on what they're telling us.
Okay, thank you for that overview. So I have a couple of specific questions. First is let's talk about the magnet recognition. You now have 8 locations, I believe, that have magnet recognition. Why was that important to pursue? And what is it that led to getting that success of getting the magnet recognition?
Yeah, so I have to say, first of all, I think that is a true reflection of a long-term commitment from our senior leaders all the way down to our facility leaderships. And I'd be remiss if I didn't say at some point that I think we have the best CNOs in the country, bar none, right? And I don't take that lightly. I truly mean that, because they are completely dedicated to what Magnet stands for, and then their facilities are dedicated to that, and we as a system are dedicated to that. And it's about, how do we truly engage our leadership in a way where they can produce quality outcomes? They actually have the authority and the autonomy to make decisions on their unit to produce those types of outcomes. How do we create a structure where they can do that, where we free them up to make some of those decisions? And how do we work through our shared governance, very active shared governance committee? And one of the things that we're doing this year is we're transitioning to professional practice, where we actually own our practice. And then we're implementing a Congress model where all of our facilities chairs will come to a central location, and we will actually take a look at, what are the things that are working, what aren't, and what is it that you want to put on the table, and how do we resource that from a system to make sure that we can deliver on that. All of those principles take an incredible amount of dedication. It's not easy, but it's one of the things that I think is well worth it, because what it has done is really put us in a spot where we're delivering high quality care, and our staff, they can feel that, they can see that, and we don't want anybody going home at the end of the shift thinking, man, I left something on the table, or I didn't do my best job. And every day we want to work to make sure we're closing that gap.
Okay, so one maybe a slightly more controversial item related to Magnet, just because it comes up with other health systems. One of the requirements in Magnet is a certain percentage of the nursing workforce having a BSN.
Correct.
That sometimes can make it a little difficult from a talent acquisition or retention standpoint, because it's a bit exclusionary, right? to require 80% of nurses to have a bachelor's degree, and when we know that there's associate's degrees or diplomas, so on. How do you both navigate that requirement and make sure you're meeting the Magnet requirements while also not excluding some members of the nursing workforce?
Yeah, so I'll expand it even more, Iman, as the LVN question, right? And so these are the questions we get all the time being a Magnet. And what we know is not everybody has access to school at the same, right out of high school and to go get their bachelor's degree. So we are committed to really taking a look at our academic partnerships We, through our Work Well strategy, have an opportunity to have a no-cost tuition where there's no money out of your pocket and you can go to school. And so then how do we take these career pathways from working with the high schools that we work with in our community to where they can go to an LVN program? Because not everybody's geared to go to college right out of high school. I was one of those. Didn't really go back till I was in my mid-20s. And then, you take it a little bit more serious, for me anyway. but aligning that individual with a good working job, whether it be an LVN, sterile processing, patient care tech, there are several in that entry into healthcare as a career type job. And then how do we then wrap services around them to where they can continue that education? And it really is a journey, right? And those are great stories to tell. And I'll tell one quick story here of one of the things that we've kind of jumped into, really looking at how do we engage differently in our community. And one of the things we found is individuals who are pursuing an LVN pathway. What we have found is in our community, pretty much all the schools are Monday, Tuesday, Wednesday, Thursday. And so the plan is typically centered around, well, I, as a patient care tech, have to keep my insurance. And then, by the way, I got to work full time if Memorial Hermann is going to pay my tuition. And so that would make me having to work Friday, Saturday, Sunday. So what we have come up with is our commitment to making sure that we're supporting our career pathway is we've created a program where we'll actually pay for a day of your work. And so we're piloting this. We took a small group to begin with, and we're actually taking that individual and giving them a day off, if you will, to study, where they can keep their benefits and continue on through their education. And that puts that person from an LVN to an RN or an ADN to a BSN pathway. And it's life-changing, right? And so we're doing that all throughout our pipeline. So I don't necessarily see that as a bad thing. I see that as opportunity. Because I think if you're truly invested as a system into growth, we know that's like on your list was like one of the number one things. We talk about it all the time, right? It comes up in every venue. But if you're truly invested into growth and you can show where you're delivering on that, people want to work for you and they deliver amazing care. And we can actually give them the tools they need, and they can go from working in a clinic to med surge to an OR to a NICU to wherever they want to go. And we can support that through fellowships and other types of opportunities that we have in our system.
Matt, anything else you want to add on the hiring BSN nurses versus non-BSN?
I think Bryan really hit it. I think the big focus for us has really been how do we support them in that career journey, and how do we give them the resources that they need. And a big piece for us is that tuition payment program that we have, tuition reimbursement as well as tuition prepayment, where there's no out-of-pocket cost for them, and also just providing that support in terms of the career path that they can take and the directions that they can take within our organization. And we'll talk a little bit more about it, but how do we kind of start pipelining and growing them from the very beginning, from the time that they're a student until the time that they get into the residency program, and then even into we've got a fellowship program that we offer as well in multiple areas with nursing in particular, where we offer cross training and transition practice through that fellowship program and into different specialty areas. So they could move in any number of directions depending on what their interests are. And, we really support them in that career growth and that career path. So a lot of exciting things happening. And we're always looking at that. We're always looking at for ways that we can improve those programs and the benefits that we offer. We got a great HR team, a great benefits team that is always looking at that from year to year. And, what else is out there? What else do people want? What else do people need? And where else can we support them in their career?
Yeah. And I would add, we are dedicated to, we 100%, the magnet principle around, highly educated equals high level of delivery of care. We're 100% educated. 100% dedicated to that principle. So I don't want it to come across like we're not. It's just that in our workforce, I think we have to be flexible to understand and meet people where they are, then support them to get them to that point. And that's we put a lot of energy into that.
Bryan, you mentioned the equity, diversity, and inclusion priority that your team is pursuing. Can you share a little bit more with us around how you're implementing that?
Yeah, so there's, and again, I want to go back to giving Dr. Toy Harris and her team all the credit here, as they're really putting a lot of organization around the work that's going on right now. So 2022, I guess this last go around, the Houston Business Journal recognized us and 30 other organizations in Houston for our work in this. And what we're looking at, EDI is bigger than the community you're from or your race. It really is about looking at our disability, our veterans. It's about, our pride, our other types of emerging professionals, whether you be young leaders or women, and so it really is taking this broad approach to our EDI strategy. Internally, we've started some employee resource groups. I'm very happy to say I'm the sponsor of our veteran group. I was 20 years in the Army, and so really excited about some of the work we're doing in that space. And then it's about how do we then connect with our communities and partner differently with our communities, because how do you know if you don't have a hospital in your community? How do you know if you even want to work in a hospital? Where do you get exposed to jobs that are in these buildings? Are pretty big. They're intimidating. Yeah. And some of the work we've done in a past life with high schoolers, you ask them, have you thought about a job in healthcare? And they're like, I don't even know what jobs are in healthcare. They know nurses and doctors, right? But there's thousands of jobs in healthcare. And so how do we partner differently with our communities to make sure that we are opening the doors, especially in those areas where our facilities sit? Because we truly believe that if you can make that type of connection, that actually helps your pipeline, but it also helps the care you deliver, because you're aligned with that individual that's in the bed, because that's your neighbor, right? And we just believe that's a way that we're going to just continue to elevate the bar on what we deliver every day.
Okay.
Mona, I'll just make a quick comment on that piece too, from an ED&I perspective. This has been a real focus for us from a TA perspective, as well as we think about how do we make sure that we are looking at our TA and our hiring practices and what we do from a talent acquisition perspective through an ED&I lens. So we've actually been working on this over the course of the last year, and going to still continue to work on this over the course of the next couple of years, and making sure that we're attracting a diverse talent pool, as well as moving them through the process and hiring diverse talent. And fortunately, we've got a very diverse workforce, and I think we've been good at doing that. But just how do we make sure that we're intentional in what we do? Setting up those community programs, as Bryan had talked about. Engaging with our employee resource groups is another big piece of the project around ED&I, and how do we engage with them and collaborate with them on a talent attraction as well, going out to events, hosting events with them. What are we doing from a sourcing perspective? How can we really partner with some of our employees to be able to build on some of those hiring practices? So we're excited about it. We think it's a great initiative for us, and certainly something we're going to continue to focus on, especially as it pertains to hiring.
It's something that earlier this morning we were in a meeting, and we had actually members that were from the community. One was a VP, is currently a VP in our system, and another is a manager. And how cool is it that we can take some of these initiatives and then connect it back to like a high school they came from, and show that, hey, these are opportunities that are available to you. And that's that we're putting a lot of energy in that. And it's really exciting. And the enthusiasm of our teams around that approach is incredible. It's one of those things that just makes your heart swell when you look at changing the individuals that are really lining up to help change somebody's future. It's just one of those things that makes you feel good.
Yeah, absolutely. Hugely impactful. And so many studies show that the healthcare workforce does need to reflect the patient population in terms of just backgrounds, demographics, and so on, and that actually does lead to better outcomes and care.
Absolutely.
Fantastic. Okay, I'd love to go deeper into the topic of nurse retention. Right. So we shared earlier how some of the top things nurses are looking for is career advancement and flexible scheduling. So let's start with the career advancement topic. And Bryan, you shared earlier already about some of the pipeline work that you're doing and how you're, moving people from high school to community college, to LVNs, to RNs, and to BSN and so on. Can you just share a little bit more about what you have in place for career advancement and training programs for nurses at Memorial Hermann?
Yeah, so when we take a look at, career advancement, I often joke and say that, not everybody makes the right choice to be a nurse, but we'll support, we need everybody. And I say that, I'm the chief nurse, so I have to plug the nursing side, but it is true. I mean, when we look at career advancement, sometimes we really get kind of locked into the nursing pathway, right? And that is just because of where we are in healthcare right now. In Texas, you had shown a couple of the national numbers. In Texas, in 2032, we're expected to be 59,000 RN short. 29,000 of that is going to be in the greater Houston area. And so, and that number is no different when you look at LVNs and nurse aides and those types of specialties and all the way through the line. So we need everybody. So it really is about creating some flexibility to where if I come into a system and I'm working as a patient care tech as an entry into a healthcare type experience where I'm getting my tuition paid and I say, whoa, this is not what I thought it was. Well, then it's about having a conversation to say, well, we have openings as a registration. We have opening in these, other types of environments, maybe sterile processing or things like that. Maybe you want to be respiratory therapy. And so having some of those conversations to take, instead of just in, pre-COVID in the healthcare industry, that individual would probably be looking for another job, where now we can say, hey, we have these opportunities within our walls, within our system. How do we align you with that? Same thing with nurses who decide, maybe I think out of school, I want to be in the NICU. When I get there and I see how little and complicated that those little guys are, and I say, whoa, wait a minute, maybe this isn't for me. Again, it's how do we then have a conversation to say, well, I can put you through this program to get you to an ICU. We have these other opportunities. And then, the virtual space is exploding, as we speak, right? And so it really is about having that conversation, making sure we're putting a lot of energy into how do we free our managers' time up so that they can do things like round on employees and have meaningful conversations and align, with their career goals. A lot of work to do in that space. I think everybody's kind of focused on how do we remove some of these administrative burdens, but we're really taking a deep look at that is how do we kind of remove some of the scheduling burden? We have a central staffing pool that is incredibly robust. And so how do we work with the managers so they're not spending so much time in that admin space, but really can connect deeply with those employees to make sure that we are meeting their needs?
And then do you have centers of excellence or a nursing institute, those kind of approaches too?
We do. So I'm very happy to talk about our nursing institute for excellence. So we just what we're seeing right now with a lot of, how the economics of healthcare has reset over the last year or so. You see a lot of facilities kind of pulling back, and we're actually going the other way. We're actually investing differently in our pipeline. And so we started a nursing institute for excellence. And that is really looking at how do we take a look at these career pipelines, what's working, what's not working. How do we take an individual who has a great idea at the bedside and really resource them with nurse researchers and say, hey, let's answer your question, because not everybody knows how to do a process improvement program. Or maybe we can align them. We have a Rapid Process Improvement Academy. We can align them with that. There's all kinds of things that we can do. So really taking a look at our Nursing Institute and aligning that to innovation. We've also, we have an innovation hub that we started up this year. And we have a couple of initiatives. Nursing had a few of the ones right out the gate, looking at how do we create efficiency for a manager, and at the same time, how do we track competencies and do that work differently? And again, all of that's geared towards A, I have a better experience as an individual going through that program, but B, how do that I then align that person with onboarding that they need specifically for them so that we can make sure that we're meeting their needs so they can do their job and provide great care to our patients.
Okay, let's talk about flexible scheduling next. So we work with over 700 hospitals and health systems, and as a software company, we have the ability to survey and study those hospitals too. So in a recent study, our healthcare executive study, we found that 80% of younger nurses, so Gen Z and millennial nurses, want more flexible scheduling, but only 11% of health systems actually offer flexible scheduling. Love to hear your philosophy on this topic, Bryan, and what you're thinking about implementing.
Yeah, so there's a lot. You're right. There's a lot I think we can do in this space. Some of it is really a technology challenge, right? Because as we take a look at, if I have somebody call in today, the 32 steps I have to go through to get that position filled, we got to figure out how to make that better. And then at the same time, if I have somebody who wants to work a 5-hour shift, how do we do that? So I will, full transparency tell you that we still got a lot of work to do in that space. We're committed to that space, but it's one of those that I will tell you that when you take a look at how volumes in like a labor and delivery work, right? We know that there are peaks and valleys, and so how do we then inject initially different 10 hours or 8-hour shifts within those schedules? We have groups working on that right now to take a look at, how do we do that? How do we have a working parent who wants to work a 5-hour shift? We could certainly use that in lots of spaces. So how do we put those? So we're actively engaged in those, but I do believe this concept is going to catch on, and we use our central staffing pool. We have a large pool of individuals who pick up shifts for us, so we know this works. But then how do we just make that for the frontline manager is easy and accessible? I think that's the bridge we got to jump.
Okay, absolutely. Yeah, absolutely. I mean, what we're seeing more and more health systems do is offer self-scheduling and offer basically a menu of options, right? So full-time, part-time, weekend shifts, 8-hour shifts, 4-hour shifts, 6-hour shifts. But you're right, the challenge is in implementing and operationalizing all of that. That's where it gets very tricky. It's what the talent wants, though, right? So we have to head in that direction. Yeah.
And at the same time, when you're working across multiple disciplines, right, with you have patient care techs and LVNs and RNs, the complexity around it is not to be underestimated.
Yeah.
But we're committed to making that happen and making it more visible and doing things where, I have the technology where if I want to pick the shift up, I can pick the shift up and it doesn't land on the manager to actually have to go in and do 16 things to make sure that I'm aligned with the shift and I get paid, right? And so those are things that we are actively engaged in right now to make sure that we are supporting that vision.
Great. So we talk about career advancement, talk about flexible scheduling, which hopefully will keep improving retention. Bryan, are you open to sharing your nursing turnover rate or retention numbers and how that's evolving?
Yeah, so I think annualized we're about 13%, and year to date we're about 12%. So I think what we're doing is working, and we're doing a lot of the things that I think probably just about everybody in the industry is doing with stay interviews. We're doing the root cause analysis if we do have somebody who leaves us, and then at the same time that first year, putting a lot of energy into that first year turnover. I think for every health system that's a big bucket of individuals, because the work we do is hard, right? And I don't always align with maybe I thought this job is going to be something different than what it actually turned out to be. And so how do we have these conversations much sooner with like 30, 60, 90-day check-ins? And then how do we take a look at those individuals and track, well, if I'm in trouble and I should be, at a certain point in my competency program for my onboarding, and I'm 2 or 3 weeks behind, how do we proactively have a discussion to say, hey, let's move you from maybe this ICU role that you wanted down to an intermediate care unit where you can work there a year or two, wherever you get comfortable, then we can advance you up into where you want to be. And so it really is about having some of those types of conversations earlier, on top of the leader rounding and some of those types of things, and really investing in the development of our leaders at the same time, so that they have the tools they need to make sure that they're taking care of our workforce.
Okay. Just a reminder to the audience, we have some Q&A time at the end. Please feel free to submit your questions in the chat as well. All right, let's transition to the topic of hiring. I'd love to ask Matt a few questions. So before we dive into the details and the strategy, one of the most effective situations happening at Memorial Hermann is a strong collaboration between talent acquisition and nursing. And we generally never take that for granted because it doesn't happen in every hospital and health system. What are the specific tactics you put in place, Matt, to make sure there's a very strong collaboration and communication between talent acquisition and nursing?
Yeah, that's a great point, Aman. So fortunately at Memorial Hermann, we do have a very strong partnership with our nursing leaders. And it starts really with Bryan, of course, as the chief nursing executive. And then, of course, with our CNOs as well. As Bryan had mentioned, we've got great CNOs. We've got a great partnership with those CNOs. We'll attend. They've got a regular meeting that TA attends from time to time. So we go in there, we talk about what's happening in TA, we hear about what's happening across the system and also what's on the horizon. So fortunately, there's a very strong collaboration there. We've got, really the way that we build those partnerships is just regularly setting up time to meet with them. So we've got weekly, biweekly, monthly meetings that we host with our nursing leaders at the different campuses. You talked about the size of our system and how broad it is across the Houston community. And we make it a point to really get out there and meet with those nursing leaders to, like I said, number one, to understand what's happening out there at our campuses. What are the challenges that we're seeing? What are the challenges that they're seeing? What's on the horizon as well? We've got a lot of expansion happening at our organization. So growth and expansion. So just understanding what are going to be the needs around the growth and expansion. And then it also gives us a chance to talk about what we're doing in talent acquisition. As I'd mentioned, we've got a very strong talent acquisition team, great leaders in talent acquisition with our managers. And so gives them and us a chance to really talk about some of the things that we're doing in TA, what we're seeing out there in the market as well. You showed some of those statistics. We always like to bring some of that with us and say, hey, here's what we're seeing out there. Here is the challenges, but also here's the opportunities for us. And then also come with some ideas and some strategies for them. And, they're always open to trying new things. One thing I'll mention too, that's been effective for us is, we've got a seat at the table at our monthly, typically it's monthly, our operational reviews with our senior leaders at the campuses. And that's been really helpful for us. It really gives us a chance to hear about operationally what's going on at the campuses. We actually have a segment where we talk about what we're doing in TA and hiring and how it's impacting the campus. And so that's been really helpful for us. Number one, to understand what's going on and for them to see what's happening in hiring, but also just to build those partnerships, get to know them a bit better. And I think the more you build that partnership and trust, the better that hiring process is, and the more we can attract, good quality talent to the organization. And as I'd mentioned, they're always open to new ideas, new strategies. I know when Bryan first came on, one of the things that we worked on was a streamlined hiring process. And so that was a real partnership with Bryan, as well as our CNOs and our TA managers, as well as our whole TA team, the nursing recruiters. And, we put that in place where we are doing either on-the-spot offers or a lot of times same-day offers or offers within 24 hours, getting candidates through the process quicker, making sure that we're identifying good quality talent to begin with through our screening process. And so there's a whole process that we put in place around that. And it started just with that initial partnership with our leaders, our nursing leaders, as well as our TA leaders, and a good collaboration there. And it obviously takes both sides to make that work. And so it was driven from the top, but supported by our teams. And so, I think just that piece alone has been helpful for us to hire really strong talent in an efficient way in the nursing space.
Yeah, and I think it's important to note, this hasn't been easy over the last few years. So a lot of emotion and energy. And so it really is about coming together and figuring out how do we work in this space? How do we resource, might be needing to resource Matt's team a little differently, or look at, some other type of structure that we need to make sure that we are supporting the efforts. But it really is that continual discussion around, if we're opening something new, or we're just have a shortage, what is it that we need? How can we support Matt's team? How can they support us? And really having this collaborative push going forward. And again, it's not always easy, right? There always seems to be opportunities where you could do better in every space, but it's really having that willingness to have those hard conversations. I think that's what makes most helps us make the most progress.
Yeah, absolutely. I mean, upgrading and streamlining your hiring process is not easy.
Yeah, but it's needed, just because, as you talked about, the competition out there, right? I mean, it's, a lot of times when you're talking with good, strong nursing talent, they're also talking with 3 or 4 other organizations. So the faster you can get them through the process and the quicker you can make decisions and know that you want to bring them on board, then the more likely it is that they're going to join your organization. So that's been an effective hiring practice for us.
Yeah, 100%. I mean, one sort of data point I'll share is that we operate in multiple markets in the US, and in every single market that we're in, it's the health system that hires the fastest, that hires the most, and hires the best quality talent. It is not the health system with the highest compensation. It's not necessarily the health system with the biggest employer brand. It is the one that is moving the fastest internally to hire quickly. And that has proven out in every single city in the US. So that's fantastic. Matt, would you be able to share a little bit more just about your strategies for driving nurse hiring and for increasing the amount of nurse hires that are coming into Memorial Hermann?
Yeah, sure. Happy to. So as we think about like some of our hiring practices, and Bryan kind of touched on this a little bit earlier, couple of things organically, we've got our PSN program with career progression into our residency program. So that's a professional student nurse that kind of moves throughout the organization or through, in their career at Memorial Hermann and moves into that residency program and kind of gets fast tracked into that program. And so that's one piece that's been really effective for us. We also have our fellowship programs into specialty areas. So those are 2 programs that have been really effective for us from an organic perspective when it comes to hiring. We also have various sourcing opportunities that our team handles as well. We've got a really strong sourcing team that utilizes various databases out there as well. As I'd mentioned, it's a lot of what we do is about, number one, growing our own, but also about outreach. And so we utilize a lot of different databases and different channels for outreach. So they look at what are ways that we're going to be able to target those nurses out there. How can we reach out to them? How can we start that conversation and really give them a good understanding of Memorial Hermann? We not only do that locally, but we're doing a lot more regional and national sourcing. And so that's been effective for us as well. Good outreach strategy. We do a lot with social media as well. So we look at, how can we tap into social media sites, into groups out there. Our team belongs to a lot of social media groups and is able to network with some of these individuals in some of those groups, again, kind of more from an organic perspective, and then, sharing opportunities from time to time in some of those groups. And so that's been effective for us as well. We've got a strong employer brand, which has been very helpful for us. A lot of people, especially locally and regionally, know about Memorial Hermann and know about, us as a great employer. We're actually getting ready to refresh that a little bit. We're going to kind of roll that out later this year, some refresh messaging and who we are as an organization. But that's been super helpful for us, and just people knowing who we are and what a great organization we are. And then we also do a good bit of outreach to previous employees. We call it our boomerang campaigns. And so that's been effective for us as well, to take a look at past employees who maybe have left the organization and would be interested in coming back to Memorial Hermann. So we try to keep in touch with them. Our hiring leaders do a good job of keeping in touch with those individuals. And so we put together campaigns a lot of times to do outreach. Bryan was a part of a recent one that we did around our labor and delivery recruiting. And so we had a nice campaign around that, but it's it's really kind of taking a look at some of those individuals that we'd like to bring back to the organization and just keeping in touch with them. So I think those are just a few of the, things that have been effective for us from a hiring perspective.
Yeah, Matt, I'll add, when we're doing things in the partnership together, like he mentioned, our professional student nurse program, when we can have individuals and hire them while they're in nursing school, and then they just transition into the job they want, what has happened is now we have decreased the burden on the TA team because that's a position that's filled. We have decreased the burden on the manager's schedule because now that's an interview that I don't have to do, because it's like the best on-site interview in the world because you're working on the unit for like 2 years. And so it really is a partnership. So it's not just about the pipeline, but it's creating those efficiencies that really pay off over a long period of time.
Absolutely.
Yeah.
Right.
Well, one more thing I'll mention, Aman, just around our team, our employee base here as well is, I think we do a nice job of creating brand ambassadors out of our employees, our nurses, as well as our nursing leaders. They're always attending, educational seminars, attending conferences. And so, we've really made a focus on how do we engage them when they're out there talking with other nurses, and how do we create brand ambassadors out of them? We've given them talking points. We've given them various materials, including some brand ambassador cards that they can take with them when they're at conferences, and they can hand it out with a little QR code that drives candidates back to our career site to look at job opportunities. And so it's really about kind of taking a look at your current staff, right? And if you got a strong, obviously a strong nursing staff on board, then how do you kind of engage them in that process? Because if they're very engaged, which our nurses are, and they love working there, they're going to want to go out there and talk about that with others and try to attract more talent to the organization. So that's been effective for us as well. And we're going to continue to focus on that in the future.
Fantastic. The QR code on their cards that directs them back to the career site is the first time I heard that idea.
Yeah, it's pretty easy. Yeah, we take it with us when we go to conferences, and then we hand it out to our nursing leaders and the nurses, and they love taking it with them. They put it in their purse or put it in their wallet, and then if they just meet somebody, they're like, oh yeah, you know what? We've got great opportunities, and so it's just a nice piece that helps us to promote our careers.
Great. So what I'll do next is just share a very quick overview of Incredible Health. And then we'll do Q&A. Bryan and Matt, question I ask all speakers is at the end is, what are your top 3 tips or top 3 pieces of advice to the many nursing, HR, and hospital operations leaders that are on the call and going to listen to the recording afterwards too? So I'll let you think about that while I do a quick overview. So Incredible Health is a software company. We're headquartered in San Francisco. We operate nationally. And essentially, hospitals and health systems, they use our software to hire nurses in permanent roles in less than 20 days. We work with over 700 hospitals and health systems, including Memorial Hermann. We work with very large systems like HCA and Tenet, big regional systems, including Baylor Scott & White, Wellstar, and Johns Hopkins. We work with many academic medical centers too, like Stanford and Cedars-Sinai and NYU and others. Who are, just a whole range of hospitals and health systems that are successful in hiring permanent nurses from our software-enabled career marketplace. So as far as what it is that we do, what's special about it is, first, the employers apply to the talent instead of the other way around. As you can imagine, the nurses absolutely love that. They create a profile, they sit back and relax, they get interview requests from different employers. The nurse gets to choose which interviews to accept and which ones to decline. So this is a very nurse-centric or candidate-centric platform. And it is what nurses really enjoy. You can see over 2,000 thousands of 5-star reviews across Google, Facebook, and the Apple App Store from nurses, and they often describe this as the best job search experience of their careers. The second piece is that there's some level of pre-screening that happens using our technology and our teams as well. Third, is that we provide matching algorithms. So, not every nurse and not every employer should be speaking to each other, right? So employers have very specific requirements. Nurses have very specific preferences and experiences and licenses and certifications and so on. And our matching algorithms need to match the talent to the employers accordingly. And then finally is data analytics. So leaders like Matt and Bryan have access to our data analytics reports, where they can see, where they can benchmark themselves with their local competition as well as nationally. It helps them identify bottlenecks, any process improvements that need to be made, and celebrate successes too. So as far as how we attract nurses to the platform, we currently have 1 in 4 nurses in the country using Incredible Health to manage their careers. And the simple way we do that is we offer free services and tools to nurses. We offer free continuing education to every single nurse in the country, accredited in all 50 states. We have free salary estimators. They get access to career coaching. They get access to a community where they can ask for advice from other nurses, and which they can access in both our iOS and our Android apps. All the services, all the tools is 100% free for nurses. Wanted to share a little bit of data from our platform this week. We touched on this earlier about the importance of hiring speed. You know, Matt mentioned same-day job offers, getting interviews completed very rapidly within days. 68% of nurses on the Incredible Health Marketplace accept the very first offer they received. And 61% accept the very first offer, even if the subsequent offers might have higher compensation. And that just shows the importance of speed in hiring in nursing. Part of that is because of the intense competition for the talent. And then part of it is that nurses are working, in fact, overworking while they're doing their job search. So they want an efficient, fast experience. This is just a quick case study from a team in LA. And so for this team, we were able to reduce the days to fill from 66 days down to 19 days. Where we have the biggest impact is on time to source, where we're really able to bring that down from 44 days down to 3 days. Now, of course, we have other automation, like automating interview scheduling and so on, that removes a few days later in the process too. But that's the biggest impact is on time to source. And then finally, we track retention very carefully. So our retention rates are usually about 15% higher than the hospital's baseline at the 1-year mark. The reason for that is because it's a very well thought out job search experience. You know, the nurse is able to consider multiple opportunities before selecting a specific role. And then finally, our database does skew, or our network does skew more towards experienced nurses. And experienced nurses tend to have higher retention than new graduate nurses. This is how we work together, just overall. You know, these are the 8 steps of the hiring process. Everyone roughly has the same 8 steps. We're doing a lot of the Incredible Health is doing a lot of heavy lifting the first 4 steps, so sourcing, pre-screening the talent, confirming they're actively looking and getting them automatically scheduled with the recruiters. At that point, the Memorial Hermann talent acquisition team completely takes over. They complete the phone screen. They're completing their interviews with hiring managers, getting offers out, and getting offers accepted. Essentially, the talent is entering the normal hiring process. This is a newer model in talent acquisition. It helps. You know, we talk a lot about nurses needing to operate at the top of their skill set, top of their license. We also have to have hospital recruiters, hospital nurse recruiters operating at the top of their skill set too, which is engaging with talent and engaging with hiring managers. There are things like sourcing and pre-screening that can be supported with automation like Incredible. Wanted to have permission to share a little bit of our success together in our partnership. We've had over 100 hires in permanent roles in nursing just since last year. The hires have an average of 7 years of experience, so we're definitely skewed more towards the experienced nurses. The Memorial Hermann team, the return on investment for their investment that they made in Incredible Health is over $4 million now. Essentially, by hiring permanent nurses faster, the Memorial Hermann team is able to reduce their spend on premium labor and on travel nurses. And that's essentially how the partnership more than pays for itself. Some of the top specialties we've hired in is med-surg, ICU, ED. And then I also wanted to comment that over 20% of the hires have come from out of state. City like Houston actually is an attractive city for many Americans, including nurses. And Texas overall, the Texas urban areas are experiencing an influx of talent from other parts of the country, including nursing. And so that is something that the Memorial Hermann team is absolutely able to take advantage of as well. And really, Matt already commented on the need to look at this as a national workforce and source nationally, not just locally. All right, let's go to Q&A in our last few minutes here. A few questions were submitted. It's a quick question from Grace. you have a nurse union that's causing you difficulties? You're in Texas. I imagine you don't have nurse unions. Is that right?
So there is one in Austin. I believe it was the first one in Texas.
Yeah. Any challenges with, how do you think about things like seniority of nurses when it comes to hiring? And excuse me, the seniority of the nurses that are already at Memorial Hermann versus hiring externally?
Well, I mean, this is one of the things that has really become interesting conversation over the last couple of years, because I am a firm believer of supporting our internal growth and development, and but at the same time, you know, how do you balance that with somebody who has 15, 20 years of experience who's moving in because they have a lot to add too. And so it really is a lot of work with the frontline manager, a lot of work with Matt's team and different HR, and how do we align those types of everything from pay to type of job. That's really where you've got to get down into detail work, but always a fan of our internal pipeline. But at the same time, we do know that those individuals out there have a lot to offer and bring to our facilities.
Fantastic. A question from Grace just about the nursing programs and in general the benefits you offer nurses. How are you thinking about childcare, and how are you thinking about part-time?
Matt, did you want to take that one?
Yeah, so I can take that one actually, Brian. So we actually have strong benefits when it comes to that. And you know, as we think about, you know, some of those benefits, we've got enhanced childcare benefits, what we call a safety net health coverage as well. We've got different family resources as well that we offer, different types of benefits like adoption assistance program and so forth. We've got what we call our Wealthy program, which is a benefit to help care for loved ones. And it includes various things: family caregiver support, maternity benefits, things like that. We also just recently announced that we're offering parental leave as well. And so that's a benefit that we're going to start offering in the new year, in our new fiscal year, coming up in July. So that's something that also is on our radar. So we're definitely focused on that and making sure that we're providing the benefits that we feel are going to be you know, the greatest need for our employees. You know, we listen, as Brian had mentioned, you know, the big thing for us is we listen to our employees, we hear what they're saying, we regularly have our engagement surveys, and we hear what they say in those surveys, and then we try to build our practices and benefits around that, and try to make sure that we're providing benefits that our employees need. So we're excited about that, and we feel like we've got strong benefits. We do get quite a few positive compliments around our benefits, and so that's a big focus for us.
Great. So we'd love to hear your sort of top 3 tips for your counterparts across the country that are on the call today. Brian, you want to go first?
Yeah. So top 3 for me is don't be afraid to drive. You know, we are, if you take a look at, we're the largest employer in the Houston area. And if we don't drive and work, you know, working across high school relationships, academic partnerships, is complicated, but if we don't do it, who's going to, right? And so I think we can't be afraid to drive. And then we got to hire the potential. I think that I used to be the individual that would really was looking for that highest skilled, you know, most efficient individual. But then if you can't live with them for 12 hours, you really haven't done yourself any favors. So find those individuals who really care about relationships, your patients, their fellow employees, invest in them. And I think you'll have much better outcomes. And then, you know, I think that we've got to put the patient first always. I mean, it just, as we look into, there's a lot of hard decisions out there, but as long as we take that approach, it tends to work out in the long run.
Matt, you have tips, top tips? Yeah.
Actually, so I think, you know, the first one for me, I think is, I'll share just that, you know, reading, subscribing to newsletters, reading articles, attending webinars, networking with other leaders. I mean, obviously people joining this webinar are doing that. So I think just learning as much as possible about, you know, the new things out there, what's happening in the nursing space, recruiting space, what might work for your organization is critical. Don't be afraid to try new things. That's a big thing we focus on, especially with our TA team. We're, very open to trying new things, innovative solutions, channels, obviously implementing something like Incredible Health and seeing how that works, but just different channels, different sourcing tools to propel you forward. Some things will work, some things won't. You learn and grow from it, and just kind of taking a look at how it's going to impact the organization. And then I would just say, be intentional. We talked a little bit about it today, but be intentional in how you build strong partnerships internally at your organization. How do nursing leaders, TA, HR, how do they collaborate? It's so important to hiring and retention success. And it's been one of the reasons why we've had such great success, is because of our teams here and just how we collaborate together. So I think it's just making a plan to be able to do that.
Fantastic. All right. My colleague Danny shared a few times where you can sign up for a demo if you want to learn more about Incredible Health. I know there were some questions we didn't have time for, so feel free to submit them to questions@incrediblehealth.com, and three of us will try to answer them. And just want to really thank you so much, Bryan and Matt, for joining this very well attended webinar and for sharing your strategies and tactics that you're implementing at Memorial.
Thank you so much.
Thank you. We appreciate it.
Thank you. Thanks, everybody.